The 19th of June every year is officially designated World Sickle Cell Awareness Day. The International Awareness Day is observed annually with the goal to increase public knowledge and understanding of sickle cell disease and the challenges experienced by patients, their families, and caregivers. And for a conversation around the message of this year's commemoration, we'll be joined by Dr. Olufunto Kalejaiye, a consultant physician hematologist at the Department of Medicine, Lagos University Teaching Hospital. She specializes in the management of sickle cell disease, coagulation disorders, and hematological malignancies. In addition, Dr. Kalejaiye runs the Adult Sickle Cell Clinic and the Clinic at the Lagos University Teaching Hospital, which also involves the management of post-stem cell transplant. Dr. Kalejaiye is the coordinator of Sickle Cell Club at the Teaching Hospital, which was established to provide information and awareness and well-being amongst persons living with sickle cell disease. Welcome to the show. Great to have you. Can you tell us about the theme for this year? Good morning, Doctor, once again. Can you tell us about the theme for this year and how germane it is to the sickle cell fight?
Well, many societies have had various themes for this sickle cell day. The American Society for Sickle Cell Disorders has the theme of shining the light on sickle cell disorders. The coalition of the non-governmental organizations in Nigeria have the theme saying, I am because you are. And this simply sheds more light on how the populace see and assess patients with sickle cell anemia. They want to push what is called a non-discriminatory approach, such that they are seen first as human beings and individuals, and then as sufferers of sickle cell disorders second. And therefore, they do not want to be discriminated against. The purpose for the World Sickle Cell Day, of course, is to increase awareness about sickle cell disorders as well as its management, and as well as enlightening people about the hope for cure.
Well, Dr. Kalejaiye, I understand that Nigeria has the highest number of persons living with a sickle cell disorder in the world. And yet, sickle cell anemia is not treated as a public health priority. Why is that the case? Is it because there isn't enough advocacy, or our policymakers do not really understand the severity of the disease?
Thank you for your question. While I do agree that Nigeria indeed has the highest burden of sickle cell anemia, in fact, about 2 to 3% of our population, and a population of 160 million, are affected with sickle cell anemia. I believe that not all areas in the country have the same kind of access to health care. And I believe that more public health awareness has to be made. It has to be recognized first and foremost as a public health problem in Nigeria. Because in 2008, the World Health Organization and the United Nations recognized sickle cell anemia as a public health issue. So it's something our policymakers have to adapt as well, rather than wait for people to fall ill and then deal with the consequences of morbidity and mortality. So yes, I don't think the awareness is enough, and we still have a long way to go. We still have to do much more outside just the World Sickle Cell Day. There have to be continuous campaign programs and continuous enlightening people about the need to test for genotypes, because we know that the carrier state, which is hemoglobin AS, is the driving force for sickle cell anemia. So it's important that people know what their genotypes are early. While we try to make an advocacy for neonatal testing, where babies are tested as soon as they're born, in the meantime, what can we possibly do? If we can go to the grassroots levels and have public awareness talks and campaigns, if we can talk to proprietresses of schools, for example, like preschool areas, making genotype testing part of their mandatory test, health screening tests for their students. And where this is missed, we can also extend this even to primary and secondary schools, such that by the age of decision-making and settling down with partners, people with sickle cell traits can take informed decisions. Because it's also quite clear that when two people with sickle cell traits get married, that's the ASAS genotype, every pregnancy carried by the woman has a 1 in 4 chance of having sickle cell anemia. So these people have to be aware of this and be able to take informed decisions. While we cannot make choice of partners for people, it's important they're aware of the magnitude of this problem and then be able to take informed decisions as to how to address this.
But there is legislation which seeks to basically make choices for people in Abia and Anambra states, for example, and also recently in the Senate, a bill to prevent, control, and manage sickle cell anemia also addresses the issue of who people can marry. What do you think of that approach? Can you actually legislate how people love, or whatever reason it is that people get married? Because it's not always love, frankly.
I think that's a bit of a draconian approach. The question is, have we done enough to enlighten the public? I don't think so. Do we have enough testing centers where people have access to at least check their genotypes? Have we made that provision for them? I don't think so. Does every citizen in Nigeria at least have some card on their necks talking about what their blood groups are and their genotypes are, so that's clear to everyone? As long as these things have not been put in place, where there's no widespread genotype testing, where there's a lack of education, I do not think a draconian measure preventing those that have sickle cell trait to marry should be put in place. Apart from that, I think they also should know the possible options that they may have should they choose to marry. There are tests that one can do in pregnancy to determine the genotype of the unborn child. And then it is left to the discretion of the couple whether to carry that pregnancy to term or not. But the most recent is a prenatal genetic, pre-implantation genetic determination of sickle cell. What happens is like an IVF technique. Eggs are removed from the woman and mixed with the sperm outside the body. And then at a particular stage, cells are taken from that mix and are tested for sickle cell. And those that do not have sickle cell are placed back in the woman's uterus. It's not a cheap procedure at all. So rather than get to this point, I think awareness, more campaigns, and availability of centers where all these genotype tests can be done, such that at least they have enough information about it. I can assure you those in the villages have no idea about what their genotypes are. You hear things like, oh, I don't have S in my family. And I respond, is it written on your face? So as long as these things are not put in place, I do not think it's fair to grab people and jail them simply because they've chosen to get married.
I want to talk about care for people living with sickle cell.
Yes.
And understanding. Because I've lost people very close to me. I mean, Josie Buckner used to be a former colleague of mine that I lost to sickle cell. And the case of Tosin was quite very peculiar because she was in the house alone when she had the attack and she didn't make it. I mean, what should be the care around people living with sickle cell?
Again, we have to start from enlightenment programs. Some people the educated people at least have some idea, but those that do not have much access to education have no idea and do not even know why their children die. They label them as abikus and ogbanjes and feel they've just come to have an evil rerun of life. So again, yes, so again, the enlightenment programs have to come in, explaining what the signs and symptoms of sickle cell anemia are. So I can take you back through what hemoglobin does. Hemoglobin is a molecule in the red cell that delivers oxygen to all the cells in the body. Now, with sickle cell anemia or sickle cell disorder, what happens, and the normal hemoglobin is hemoglobin A, and that more or less confers that lovely round or concave disc that allows these cells pass through vessels and supply them with and supply the organs with oxygen. With this abnormal sickle S, what happens is that there's a structural problem with the hemoglobin, and it's inherited. It's passed from parents to children. So these children do not bring these problems upon themselves. And when this happens, under conditions of what we call deoxygenation, these cells can sickle and they distort the red cells such that blood supply to the organs are more or less reduced and they can undergo infarction and death. And this is actually multisystemic. Apart from that, these sickle cells tend to stick to the vessels, and it narrows blood flow and further compromises oxygen delivery to the tissues. Apart from this, the red cell span life, or the lifespan of the red cell, reduces markedly from 90 to 120 days to about 30 days. So they are constantly anemic. So the underlying disorders have to be understood first. People have to understand that when they have patients with sickle cell anemia, they need to register them early under specialists that understand the pathophysiology and how to manage the diseases. By the time they attend their follow-up clinics, a lot of investigations are done, and the risk for complications are picked up early. And these patients can actually transit to the adult sickle cell clinics where they can continue their care. Apart from that, there are other modalities of treatment or management, even at the outpatient's clinic. We need to understand exactly what their needs are. We run tests at least to make sure that we pick any complications early. We counsel on good drug compliance, because there are many drugs now that have been used to manage sickle cell. We know about folic acid that more or less replenishes the number of cells. We know about disease-modifying drugs like hydroxyurea, so we actually insist a lot on drug compliance. And where symptoms are present, they need to go to the hospital to be properly managed. Many of our people that we know, surprisingly, they go to pharmacists who just prescribe anything to them. They call auxiliary nurses that just give them whatever they can at home. And then they come to us in actually very, very bad states. But where they've come early, tests can be conducted, or you can have investigations, and start them on the appropriate medications, at least to be able to monitor as well as reduce as best as possible mortality, morbidity and mortality from this disorder. Apart from that, we're also able to recommend other tests like exchange transfusions for those that really do not do well on our disease-modifying drugs. We also know that stem cell transplant is more or less the cure for sickle cell anemia. It is true that we do not have any, we don't have at present a functional institutional stem cell transplant center. However, the Lagos State University Hospital, in conjunction with the Sickle Cell Foundation of Nigeria and Vanderbilt University, will be starting a sickle cell center pretty soon. But in the meantime, we do have facilities to take care of post-transplant care patients. So what I think is more advocacy, more education about the symptoms, more education about the need to go to a hospital or to refer these patients early, more advocacy about about follow-up visits as well, adherence to medications, and of course, we want to prevent the complications, including crisis, as much as possible. So we educate you must drink a lot of water. You want to avoid extreme dehydration. When you have a fever, please report to hospital so it can be properly addressed. Because we know fever is one of the features that more or less drive crisis in these patients. But I think early reporting is also key. Yeah.
Dr. Kalejaiye,
Yes.
I mean, we're in the season of COVID-19.
Yes.
Are persons living with sickle cell more vulnerable in this type of season? And if so, what kind of special precautions should they take?
Well, because of the underlying immunosuppression in sickle cell disorder, they are among what we count as the vulnerable population. These include elderly people, those that have cancers, and other medical morbidities like diabetes. So apart from observing the safety precaution rules by the NCDC and the World Health Organizations, people with sickle cell anemia have to take extra precautions. We realize now that the ban has been somewhat relaxed. So we advocate, as much as possible, please stay at home. If it's possible to work from home, please do. We know that it may be difficult to keep away from crowds now the ban has been somewhat lifted. But wherever they are, they must wear face masks. And these face masks have to be worn properly. You have different styles of wearing face masks these days. Some hang at the neck, some hang below the chin, some even on the head, but that's not what we're talking about. Proper wearing of the face mask. This is not to abdicate the need for regular washing of hands for about 10 to 20 seconds with soap and running water. And then they need to take their hand sanitizers everywhere they go. They need to avoid as best as possible crowded places. And as it is now, even though the ban has been somewhat relaxed, they cannot have an influx of visitors into their homes. Even at home now, they have to practice social distancing as best as possible. It might not be very easy where there's not enough space for accommodation, but as best as possible, keep enough distance between yourself and your housemate and your house guest. Apart from that, we insist on strict adherence to medication because we want to prevent other non-COVID problems that may bring them to hospital and they'll take them out of their houses and expose them to COVID. So we insist on strict adherence to medication, especially those that are taking disease-modifying drugs like hydroxyurea that actually prevents the onset of crisis. We also try to give long prescriptions that could last for a long time to prevent their going back and forth from the pharmacies. Where they cannot go to the pharmacies, their family members could actually go to the pharmacies for them. So these are some of the ways I've been able to alleviate, or rather to prevent our patients from coming down with COVID. We also realize that because our patients are immunocompromised, should they contract COVID, it could actually run an aggressive course for them. So this is why they have to be extra careful.
That's very important to note.
Yes.
Doctor, you mentioned stem cell replacement as a cure that will soon be available in Nigeria. Can we have more details on what that procedure is like and why it's effective?
Okay, so stem cell transplant basically involves the eradication of maybe the sickle cell patients, the blood cells, as well as the immune system of the patient, and replacing with stem cells or primitive cells from another person that could be a related donor and is as closely matched as possible to this particular person. Now, in doing that, you're able to effect a change in the genotype of that person to that of the donor. And when that genotype changes, like for example, SS to AS or SS to AA, we know that the oxygen capacity carrying of those cells actually improves, oxygenation is better, and symptom relief is better, and the cause of the disease is ameliorated. So for now, that is the cure that we have for sickle cell anemia. We do know that you don't have 100%, at about 85 of 100 patients, of course, would have a successful procedure. But it's still the hope of cure for sickle cell patients.
Thank you so much, Doctor, for joining us this morning.
Thank you very much, Dr. Kalejaiye.